Food, nutrition, and dining are important to the health of people living with dementia. They can affect a person's overall health and well-being and play a part in managing risks like unplanned weight loss, malnutrition, and dehydration. Good nutrition is not just about staying healthy. It's about maintaining dignity, independence, and improving quality of life. You need to understand the changes a person living with dementia may experience in their nutrition and hydration needs so you can effectively support them. It's important to get to know each person and use a person-centered approach and find what works for them. How can dementia affect eating and drinking? People living with dementia may go through changes that affect their ability to eat and drink well. These can include loss of appetite, changes in taste and smell, difficulty eating, drinking, and swallowing, not recognizing when they are hungry, meaning they forget to eat, overeating because they forget that they've already eaten, or not recognizing when they are full. These changes might also mean the person is in pain, discomfort, or has unmet care needs. Stay aware and identify and respond to any changes or concerns quickly. If you notice any of these changes or have concerns, it's important to understand what's caused them and appropriately escalate to address them effectively. You can refer the person to relevant health professionals for specific advice and strategies to support individual needs and care planning. This can include referral to a doctor for medical assessment and treatment, a dietitian for nutritional assessment and recommendations, a dentist for an assessment of oral health, including an evaluation of a person's teeth, gums, and dentures, a speech pathologist for assessment when there are swallowing and communication difficulties, an occupational therapist for mealtime assessment and recommendations, including safe positioning and mealtime supports such as adaptive equipment, and a behavior support specialist for supporting changes in behavior. Remember, working together is key to providing effective support. This involves the provider, workers, healthcare professionals, older people, and family members working together to support each person to live a healthy life. Encourage the person living with dementia to also be involved where able to support their choice and independence. Some strategies that may also help provide effective care include having flexible meal times, including providing food and drink when a person asks for it, involving the person and their family in menu planning, offering food that looks and smells good, using different colored plates, bowls, and cutlery that are a different color to the food served, placemat, and table to help food stand out, serving foods that are familiar, regularly or routinely offer meals and drinks, and encourage social interaction and physical activity. Remember to also monitor for changes in behavior that may affect eating and drinking. As a provider, you can support people in your care by training all workers to support people with eating and drinking at mealtimes if they need it or request it. Assist the care team to create and review mealtime support strategies to identify a person's likes and dislikes and any assistance and support needs. Create a homely and calm dining environment. Be aware of potential side effects of medications that may affect eating, drinking, and safe swallowing. You can do this through regular medication reviews with pharmacists and general practitioners. There are many things you can do now to help improve the dining experience for people living with dementia. Reduce noise and distractions like turning off the TV and loud music. This helps people focus and enjoy their dining experience. Prioritize mealtimes and avoid games and activities that distract from the mealtime experience. Rearrange tables and chairs to provide different seating options that supports the person's preferences. Use natural light to create a pleasant dining atmosphere. It's important to handle food, nutrition, and dining issues with compassion and understanding. The experience of every person living with dementia is different. Find the best approach for each person to enhance quality of life, and remember that it may change as their condition changes. Check out the Commission's webinars, videos, and fact sheets to find out more about how you can support people living with dementia. You can also call the Food, Nutrition and Dining hotline on 1-800-844-044 or log into Alice, the aged care learning information solution for interactive online learning. Let's all make food, nutrition, and dining a priority